am your student nurse today. I am here to change your central line dressing. But before I do that, can you verify your name and date of birth for me? Tells me his name and date of birth, Bob Owens, 1/10/49. Yep, and that matches. And I'm checking the MAR. And yes, I have Bob Owens, date of birth matches. Order states central line dressing is due to be changed. I'm also looking for allergies, and I see that he has no known allergies, but specifically I'd be looking for things like iodine and alcohol. So we're good there. Okay, Bob, so for this procedure, it's important that you hold nice and still. I'm also going to have you wear a mask. Do you think you're going to be able to tolerate wearing a mask? And he tells me yes, and if he couldn't wear a mask, I would have him turn his head. Now I'm going to prep my sterile field. First, wash my hands. Open it up. And I have a mask. This is Bob's mask, so I'm putting that mask on Bob. I'm going to wash my hands again.
Then you're going to wash the
Pull out my sterile gloves. I'm also going to pull out my I'm going to dump this stuff over the top. Perfect. Okay. Wash my hands again. Put my gloves on. And the first thing I'm going to do is I'm going to measure the circumference of the arm 6 inches above the insertion site. Let's put brakes that on. That'll be about right there. So I'm going to measure that circumference. And the circumference measurement that I got matches the baseline that was listed in the chart. If I had more than a 1/2 inch deviation, that can indicate infiltration, phlebitis, infiltration or phlebitis, or infiltration or extravasation. Can't think of that word. That's okay. Okay, now I'm taking a look at the dressing and I'm assessing it for Rita. So I see no redness, ecchymosis, edema, or drainage, and the amount of drainage is none. And then I'm going to gently palpate the area. Bob, when I touch the site, do you have any pain? And he tells me no. Okay, very good. So next what I'm going to do is I'm going to remove the dressing.
That's the one I wanted to get. She gave me the sheet and had that on there.
Skirting from the outside. Pulling in. this was an older gentleman that had very delicate skin, I would use an alcohol swab to remove this dressing so I wouldn't damage the skin, just so it would help dissolve the glue and make removal a lot easier. Alright, so now I'm looking at the dressing and I'm assessing it for coca. So I'm looking at color, odor, consistency, and amount, and the dressing looks good. On the garbage. And then I'm taking a look here at the insertion site and also the hub where it would be, I see that there are 2 sutures that are holding the central line in place. So I don't have to worry about that. And I see no redness. Remove my gloves. I'm going to wash my hands. Next, I'm going to open my sterile gloves. So I'm going to take my alcohol prep pad. Spread things out where I can reach them. I have my alcohol prep pad. I'm also going to reach around and place my tweezers there. I'm going to open this up. And I'm going to scrub around the area, removing any blood. Making sure to get underneath and all around. Okay, and then once that's dry, I would then grab my tweezers with this hand. I'm going to lift this up. I'm going to start at the center, working my way out. I'm going to scrub for 30 seconds. And then I'm going to then use this hand is clean, so I can set these tweezers down. And I'm going to grab my skin prep wipe, and I'm going to pull the wipe out, and then I'm going to apply skin prep. Around the area, and then allow that to dry. Once that's dry, I'm going to pick up my Tegaderm. making sure not to touch the inside. I'm going to place it. Remove my old caps. And then being careful not to reach over my sterile field. I'm going to grab my first cap. And my second cap. And those are replaced. And then I'm going to remove my sterile gloves. I'm going to wash my hands. I can then remove Bob's mask. Back him on the garbage. And wash my hands again. And create my label. With my name, initials, and the time. I'm gonna stick that right on the bottom here. A base. And then I would clean up my supplies. Patient back to a safe position. Make sure he has access to his call light. Bob, is there anything else that I can get for you, or are you okay? And he tells me he's fine. And I would exit the room, and I would document the date, the time of the procedure, and that the procedure was completed. I would also chart any of my assessments, my findings for my assessments that involving the dressing and any drainage or anything like that. And that's it.